Hello and welcome to Standard 13 of the Care Certificate Workbooks. My name is Daniel Dutton and I run the website dsdweb.co.uk, which provides free help, guidance and support for people that are studying for care qualifications. In this video we will be looking at Standard 13, Health and Safety. This is a mammoth standard because it comprises of a lot of different subtopics related to health and safety, including fire safety, infection control, hazardous substances, amongst others. But together we will get through it. For further information about this standard, visit DSD-Web by clicking the link in the description. And as always, try to relate the information in this video to your own practice and write your answers in your own words. Before continuing, please hit the thumbs up button to like this video. Even if you have already liked my previous videos, please like this one as well. It makes a big difference to the channel, and if you've not done so already, please click the button in the bottom right of the screen to subscribe to my channel and be kept updated with any other videos I produce. The first activity asks you to identify 6 pieces of legislation relating to health and safety. The main piece of legislation is the Health and Safety at Work Act 1974, which sets out the roles and responsibilities of employers and employees with relation to health and safety. On its own, the Health and Safety at Work Act is rather generalised, so additional regulations were developed for particular situations. Some of these are the Management of Health and Safety at Work Regulations 1999. This sets out what employers are expected to do to comply with the Health and Safety at Work Act. Primarily, employers have the responsibility to conduct risk assessments to minimise or eliminate the risk of harm in the workplace. The Control of Substances Hazardous to Health Regulations 2002 sets out rules for the handling of hazardous substances. The Reporting of Injuries, Diseases and Dangerous Occurrences Regulations 2013 makes it an employer's responsibility to report certain incidents to the Health and Safety Executive. The Provision and Use of Work Equipment Regulations 2002 places duties on people and companies who own, operate or have control over work equipment. And the Lifting Operations and Lifting Equipment Regulations 1998 places duties on people and companies who own, operate or have control over lifting equipment. Activity 13.1b asks you to speak to your manager or a senior member of staff about your organisation's health and safety, and then write down the main points of 4 of your employer's policies and procedures. Of course, this is going to vary between employers and whatever your duty and role is. So it's important that you check the specific agreed ways of working for your own setting. However, some options could be a health and safety policy and procedure. All employees are to take reasonable care of themselves and others. A medication administration procedure. Medication should be stored safely. Wash hands before handling medication. Respect individuals' right to refuse medication. A fire safety policy. Fire exits should be clear. Regular fire drills. Perform fire safety risk assessments. Check smoke alarms regularly. Visitor procedure. All visitors must report to reception, sign in and wear a visitor's badge. Manual handling policy and procedure. All staff must receive manual handling training and lift and carry objects safely and correctly. The next activity asks you to outline the main health and safety responsibilities of yourself, your employer and others. All employees, including yourself, must take reasonable care of themselves and others and not do anything or omit to do something that could put themselves or others at risk of harm. You must follow policies and procedures correctly and report any health and safety concerns you have to your manager as soon as possible. Some of your employer's responsibilities include writing policies and procedures and making them accessible, performing risk assessments, and providing suitable training and equipment for employees to carry out their role effectively. Others can refer to visitors, clients, or contractors and they too have a responsibility towards health and safety. They must not perform any actions that could risk the health and safety of themselves or others. They should follow rules or instructions within the workplace, and they should report any concerns that they have. The next activity asks you to list 5 health and safety tasks that you must not perform unless you have had specialist training. Training is required for some tasks to ensure that you are able to do them safely and correctly, and usually have a practical element to them. These tasks can include assisting with transitions and repositioning, using manual handling equipment such as hoists and lifts, food hygiene handling and preparation, handling medication including storage, administration and disposal, first aid, and emergency procedures. There are times when you may need to obtain information or guidance in relation to health and safety. The next activity asks you to list 3 such sources and explain how you would access it and how it could help you. Some examples for you to consider include speaking to your manager either informally or during supervision or team meetings. They should be able to advise you and answer any questions that you have about health and safety. Reading policies and procedures to understand your responsibilities and how to perform tasks safely. Equipment instructions, posters, warning signs and labels can also help with this. Visiting the Health and Safety Executive or HSE website on your phone, tablet or computer can help you to understand the responsibilities of yourself and others, as well as being packed with information about how to ensure health and safety in the workplace. The next question asks you to list some different types of accidents or sudden illnesses that could occur in your workplace. Some accidents that you may want to consider include slips, trips and falls, burns and scalds, sharps injuries and cuts, electrocution, and injuries from equipment malfunctioning or equipment not being used correctly. And some sudden illnesses could be an outbreak of infection, food poisoning, epileptic seizure, diabetic coma, heart attack or stroke. Looking at your list of accidents and sudden illnesses, the next activity asks you to choose 3 from each category and describe the procedure you would follow if it were to happen. So for accidents, you could choose an individual cutting their finger whilst chopping vegetables, and the procedure you may follow would be to support them to clean and cover the wound and check for signs of infection over the following days. You may also record it in an accident book. For sudden illness, you may decide choosing an individual that is having an epileptic seizure. You would follow the guidance in their care plan and stay with them to reassure them until the seizure ends. You may loosen their collar or cushion their head and only call for medical assistance if the seizure lasts for more than 5 minutes. You should also record when the seizure begins and ends. These 2 examples should help you to think of another 4 accidents and sudden illnesses that are specific to your own setting. Activity 13.2a provides you with 3 examples and asks you to explain why it would be important to assess health and safety risks. The first example is moving an individual with a hoist or wheelchair. It would be important to assess risk to prevent harm to employees or individuals that could be caused by operating equipment incorrectly or equipment malfunctioning. It would also be needed to ensure that the individual is as comfortable as possible and that their dignity is maintained. The second example is providing personal care to an individual. A risk assessment would help ensure that the individual maintains their dignity and would reduce the likelihood of abuse. It would also help to reduce the risk of infection and ensure that an individual's wishes and preferences are respected. Finally, a risk assessment for changing soiled bed linen would ensure that the risk of infection and cross-contamination is kept to a minimum. Activity 13.2b asks you to look at the agreed ways of working that your organisation has in place for reporting health and safety concerns and explain how and when you would use them. You should follow reporting procedures that are in place for your own organisation. However, all health and safety concerns should be reported immediately so they can be dealt with before anyone comes to any harm. You will usually report health and safety concerns to your manager. However, some organisations may have a designated health and safety lead. The next activity provides you with 3 pieces of legislation related to moving and handling and asks you to match them with their descriptions. So the Manual Handling Operations Regulations 1992 specifically cover all movement or support of any load by physical effort. The Lifting Operations and Lifting Equipment Regulations 1998 set specific requirements relating to work equipment used for lifting and lowering people or loads. The Provision and Use of Work Equipment Regulations 1998 ensures that the equipment employers provide is suitable and safe for its intended use. Activity 13.3b asks you to list 3 moving and assisting tasks that you should not carry out unless you have received the correct training. Some examples that you could use are the use of lifting equipment such as hoists, assisting an individual with bathing or showering, using a mobility aid such as a wheelchair, repositioning an individual, and supporting an individual with other transitions such as from sitting to standing positions. The next question asks you to make a list of first aid actions that you can and cannot perform. This will be dependent on your own basic life support and first aid training. Basic life support is part of the care certificate and we discussed it in the previous video. However, it is not the same as first aid. Basic life support includes actions to take if an individual is choking or not breathing to prevent their conditioning from worsening until medical assistance arrives. First aid includes basic life support as well as what to do in other medical situations such as broken bones and cuts. If you've not had training in first aid, you should do as little as possible to keep the individual stable and alive until professional medical assistance arrives. You should stay with them and provide comfort and reassurance, as well as observing and remembering any information the individual provides that may be useful to pass on to professionals. You should also make a record of what happened as soon as you are able to do so. If you are unsure about which first aid tasks you can and cannot perform, speak to your manager for clarification. The next activity asks you to check your employer's agreed ways of working and describe the key points relating to medication and healthcare tasks. Again, this is going to be something that is specific to your own organisation and role. However, some examples could be controlled drugs must be stored in a locked cupboard, unwanted or expired medicine should be returned to the pharmacy, medication can only be administered by individuals with sufficient training, consent is required to perform healthcare tasks, or healthcare tasks should be performed in line with an individual's care plan. Carrying on from the previous activity, you are now asked to list 4 medication and healthcare related tasks that should not be carried out unless you have received the appropriate training. Some examples of this would be dispensing medication, administering medication, assisting with injections, cutting or filing fingernails and toenails. Activity 13.6a asks you to make a list of 4 hazardous substances in your workplace and explain why each is hazardous. When you locate a hazardous substance, you may be able to look at the label and directions to discover why it may be harmful. Some examples you could use are bleach, which is a skin irritant and can damage your eyes when in direct contact. It is also poisonous if ingested. Bodily fluids can transmit infections. Out-of-date food can result in food poisoning. Medication can result in harm if administered incorrectly. Activity 13.7a explores fire safety and asks you to list measures that can prevent fires from starting and spreading, and to explain how and why they work. There are several options you could use for preventing fires from starting. For example, regularly checking electrical equipment for frayed cables prevents fires from igniting from a spark from an exposed wire. Keeping a tidy workplace with minimum clutter ensures that there is less fuel available for a fire to burn through, and this could also be used to stop fires from spreading. Having a designated smoking area that is outside reduces the risk of naked flames being used within the building and fires starting from unextinguished cigarettes. Tumble dryers can get very hot and collect highly flammable lint, so ensuring the lint tray is emptied regularly can reduce the risk of it catching fire. To prevent fires from spreading, you could ensure that you do not leave cooking unattended. This means that if something in the oven or on the hob caught fire, you will be able to handle it quickly before it spread. As said previously, minimising clutter in the building means that there are less things that can burn, as well as making evacuation quicker and safer. If you are trained in their use, equipment such as fire extinguishers or fire blankets can be used to control fires before they get too big. And keeping doors closed acts as a barrier to fire and reduces the speed at which it can spread. Continuing with fire safety, activity 13.7b asks you to read your own workplace fire procedure and describe the steps to take in the event of a fire. Obviously, this will vary between workplaces, however, some general steps may be: extinguish the fire if safe to do so, if not possible, raise the alarm. Verbally prompt clients to exit the premises via the front door. If the front door is blocked, verbally prompt clients to exit the premises via the back door, or if both exits are blocked, a downstairs window. Escort clients to the fire assembly point. Call emergency services. Ensure no one re-enters the building until safe to do so. With activity 13.8a, we move on to workplace security, and you're asked to describe 5 measures that your organisation has in place to protect the safety and security of yourself and others. Each workplace is different, so you will need to find out what measures are in place for your particular organisation. You could do this by reading agreed ways of working or asking your manager. Some possibilities include the use of security systems such as burglar alarms and CCTV to protect the premises. Your organisation may have a procedure for when people come to visit the workplace. This could include checking their identity, signing a visitor's book, and being issued with a badge or a key card. This ensures that only authorised persons are granted access to the building. If you encounter a stranger in the workplace that is not displaying a badge, there may be procedures in place to challenge them to check their identity and to establish why they are there. Ensuring that colleagues know your whereabouts can also be used to raise the alarm if you were to have an accident. Continuing with the topic of security, the next activity asks you what your organisation's procedures are for checking the identity of others to ensure that no unauthorised individuals gain access to your workplace premises or confidential information. We touched on this in the previous activity, so to summarise, identity checks can be performed by checking an individual's ID card. You would ensure that the photo matches their face and the name and the organisation matches what they have told you. It may be necessary to call the organisation that they work for to confirm their identity. You may also want to ask them who they are visiting and the nature of their business. If you challenge a stranger on the premises, you may need to escort them to where they say they are going to, or check that they have signed in with reception. Before sharing any confidential information, you should always ensure that the individual has the right or need to know it. Even if a family member asks for personal information about a loved one that is in your care, you should always seek consent before sharing. When information is requested over the phone, you should check that the caller ID matches the number you have stored for the individual. If you have suspicions that they are not who they say they are, you may tell them that you will call them back on the number that you have on record for them. Moving on to stress management, and you will be pleased to hear that there are only 3 activities left to do, so we're approaching the end of this standard. The next activity asks you to give 3 signs or symptoms of stress that fall into groups of psychological signs, physical signs, and behavioural signs. Psychological signs of stress could include sadness, anxiety, irritability, anger, and indecisiveness. Physical signs of stress could include headaches, heart palpitations, and stomach complaints. Behavioural signs of stress could include getting too much or too little sleep, over or under eating, and substance misuse. The penultimate activity asks you to identify 6 triggers of stress. Think of things that trigger stress in yourself and write them down. This could include workplace demands, conflicts in relationships, tiredness, not feeling safe, making mistakes, or changes to practice. The final activity asks you to list 5 methods that you use to manage stressful times or situations. Of course, each one of us is different and we all have our own coping mechanisms, but some things to consider may be talking to friends and family, exercise, having a hot bath, reducing alcohol or caffeine intake, and meditation. And we are finally at the end of Standard 13. Well done for making it this far, just 2 more standards left to complete. If you require any additional help or want to send feedback about this video, please feel free to use the comment section below or visit my website dsdweb.co.uk. The link in the description will take you to more detailed information for this standard. And if you've not already done so, please click the like and subscribe buttons below. Thanks for watching, and until next time, goodbye.